The county commissioners have tasked us with running 13 bills for them this coming legislative session, so we'll just be a little busy this year. The two that I thought would be of most interest to the folks on the line here is the first bill, and that is increasing the license fee for retail food establishments. This is a big issue for your public health agencies. Counties, it is the option of counties to run food inspection programs out of county, and we recoup 30 to 50% of the cost of doing that through license fees we charge to restaurants. The fee is set in statute and hasn't been revisited or increased in the last 4 or 5 years. So the request from county commissioners was to go in and see if we can get an increase in the fee this year. So we will be working on that. Then the next issue that I thought might be of interest is the very last issue on the first page, local government impacts of retail marijuana. The kind of concept behind this bill is a concern by many of our members that regardless of whether or not a community has either agreed or prohibited retail sales in their community, the sense is that there will be impacts associated with the consumption of marijuana. So to give you an example, Denver, of course, is going forward with allowing for retail marijuana shops. Jefferson County, on the flip side, is prohibiting them. And there is, concerns that people will buy their weed in Denver and then go to Jefferson County and consume it there. And will there be impacts, law enforcement, judicial impacts, human service impacts, public health impacts associated with that consumption? Last year's bill, and then subsequently with the passage of AA this November, there was money set aside for communities that go forward with retail shops, but there isn't any identified revenue to help communities, counties, cities, others maybe address impact. So our 2014 bill this coming session will be a study bill. We are going to put together a task force with representatives of the marijuana industry, human services, CDPHE. Eliza, I haven't talked to you about this one, so I need to see if you want to sit in on the task force, and others, all interested stakeholders, to just have a conversation about what impacts there are, look at it from a very analytical and data-oriented manner, and then if there are, we will proceed accordingly. I think right now it's just maybe anecdotal, and we want to see, can we put some real numbers behind what those impacts are, if any. So, Christina, I'm pretty much finished. If there were any questions, I don't know if people can answer questions or ask questions, but if there are, I'm happy to field any.
So if our participants have any questions, please feel free to type them into the chat box, and we will convey those to our presenters. Do we have any questions for Jenny? If not, we will move on to our next presenter, and that is Clint Woodruff, who is acting as our interim budget officer, and he also heads up accounting. So Clint from the Colorado Department of Human Services.
Hello everyone, thank you. I believe everybody has received the budget initiatives for this upcoming season, and I will not go through all of them, but I will touch on the ones that I believe are more critical to the counties. If you look under Section 1 under the Office of Early Childhood, the first one is safety, increasing staffing for child care licensing. This is essentially a $1.3 million request, $1,290,000 of which is general fund and $60,000 is going to be cash funds for increased licensing fees. The goal here to increase our caseload ratios. Currently our current caseload ratios are 1 to 145, which is the 8th highest in the nation. And with this additional funds, we hope to reduce it down to 1 to 100, which is more in line with the national average. The next one within that same section is quality, investing in early care providers. This is a $2.2 million ask. $1.8 million of it would be general fund, and $439,000 would be matching county funds. The purpose of this is to enhance the quality of child care, and this would occur through the increasing in training and materials for training at the child care facilities, and this will occur once the facilities become rated, which will happen automatically with the Race to the Top grant. So it's not like somebody has to do something special. They will become rated automatically through the Race to the Top grant, and then based on those ratings, we'll reach out to help improve the ratings at each of these facilities and improve the training materials available for these facilities. In Section 2, under Office of Economic Security, the first item is the continuation of Rehire Colorado, which is just an extension of the current program. It's $1.2 million, which essentially is doubling the current funding available for that program. The next item is improving Colorado Works performance. This is $400,000 devoted towards TANF research, specifically for the development of a program to extract relevant data from CBMS monthly and build a database from which the department's analysis can access the data quickly for analysis. This would obviously help the program to make specific program-related decisions. Finally, under that same category is the old age pension cost of living adjustment. As many of you may know, the federal increase of 1.5% will be occurring on January 1st, and we're asking that the state match this increase with a 1.5% increase, which would start July 1st. Moving on to Section 3, Section 4, number B there, Title 4E waiver cash funds. This basically just establishes a method that the state and counties can utilize to spend the savings that we are generating from our 4E initiatives. So we are accumulating savings within our current 4E initiatives, but we do not technically have a vehicle that gives us the spending authorization, spending authority to spend this, to authorize us to spend this money. So this will take those savings, put it into this fund, and give us the authority to utilize them on enhancing child welfare. In Section 5, under the Office of Behavioral Health, item C, we have the Mental Health First Aid Colorado program. This money will be earmarked for kind of a train the trainer program. We hope to train 180 qualified instructors who then could potentially train up to 6,750 individuals to get their MHFA certification. So this would be have a broad reach for this $750,000 using a similar a type of train the trainer program. Finally, under the last section there, 7, there are the last two items, provider rate increase of 1.5%, which equates to about $10.6 million. This is in line with the provider rate increase that we were able to get for this year, and to continue to match some inflationary and rising costs for our providers. And the last one is fully fund the county tax-based relief. Currently we have approximately $2.7 million in the budget for county tax-based relief this year, and we estimate that will fully fund tiers 1 and 2, and this additional $1.2 million will fund tier 3, so that all 3 tiers will be fully funded for those counties that qualify for county tax-based relief. So those are all of the items I had to go through. Anybody that has any questions, I'd be happy to answer them to the best of my capabilities. Do we have anything?
Do we have any questions? Which providers will receive the rate increase?
For the 1.5%, I assume they're talking about that is up to the counties to administer. It is an across-the-board provider rate increase, which would be equitable for all community programs and services that are provided by contracted providers or county staff facing similar inflationary issues.
Okay. Do we have any other questions? All right, seeing none. Okay. Clint, thank you so much for your time and going over those items. Next up, we have Sarah Seals, who is the Legislative Liaison for the Colorado Department of Human Services, who will be talking about our legislative agenda for 2014.
Hey, everyone. We have 4 bills at this point, 1 placeholder.
I'm sorry, Clint, do you have time for one question before you leave? So we have one other question. Is the $6 million around the 4E waiver savings payments just a placeholder or an actual estimate of what will be distributed?
It is a placeholder. We do not actually anticipate generating $6 million of savings this year, but we hopefully will get to the point where we generate those type of savings. So we wanted to set the fund large enough that in out years any savings that we were able to generate, we would be able to distribute.
Great. Thank you for that clarification. Sarah?
So we have 4 bills and a placeholder at this point. Our first bill, and actually they're in no particular order, is changing the names of our 5 state veterans nursing homes to community living centers. So it would be the Community Living Center at Fitzsimmons, just based on the fact that we are providing more care to our vets, not necessarily long-term nursing services, but more rehabilitation type services. We have a bill, actually, and let me back up. The State Veterans Nursing Home name change bill will be carried by Senator Crowder. We're still working on House sponsors. Last year, you may recall that we ran a bill to streamline the 3 statutes concerning involuntary civil commitments. That bill ended up being a task force bill. They worked through the summer and have submitted a report to the legislature to consolidate 2 of the civil commitment statutes into 1. So we would have, instead of 3 statutes, we would go down to 2. That bill will be carried by Representative Beth McCann and Senator Linda Newell, starting in the House. We have a bill that's largely a housekeeping bill that would extend the ability of the Department of Human Services and the Department of Healthcare Policy and Financing to send Medicaid funds and general funds in those lines back and forth as appropriate to kind of just do some end-of-the-year bookkeeping. The plan for that one is, and we have a request that the Joint Budget Committee carry that bill. So far the reception, the feedback has been good. And then we essentially have, one bill on child care, foster care. This is looking like a categorical eligibility for child care assistance for foster care children ages 0 to 6. I know a lot of you have questions on where this one is going and what it's going to look like in the details. Unfortunately, at this time, we're still really trying to suss it out, and I know we've gotten some great comments and questions from our county partners as far as some folks are already doing this and how would it work with the case management and whatnot. We're still trying to work this one out, so I don't have a lot more details on that. And then the last one we have is purely a placeholder. Last year, as you all know, we were able to all work together to get House Bill 1271 concerning the child abuse and neglect routing system through the legislature. I know you all did yeoman's work over the summer with all of our community partners and state staff to come forward with some great recommendations on where that's going to go. At this point, it's my understanding we are working on a budgetary request for that that's currently a placeholder, and if we need it, we also have a placeholder there for potential legislation to address any last-minute things that might come up. But that's purely just a placeholder just so that we don't lose track of it. That's it for our agenda bills. The one thing I did want to say is I know a lot of you have been involved in various task force bills over the summer, largely around child care, from Senator Kafalis's Economic Opportunity Poverty Reduction Task Force, the Aid to the Needy Disabled, the Property Tax Heat Rate, and rebate and whatnot. We are purely monitoring those at this point. We have been providing some technical assistance just so that if they should pass, we could operationalize them. But just wanted to let you all know that we have been watching those, so if we need to get together and talk about those, we're happy to do so.
Do we have any questions for Sarah? Okay, so thank you so much, Sarah, for sharing all of the heavy lifts and the big workload that you have in the upcoming months. Up next, we had scheduled HICPOF. So, Mary Catherine, are you on the line?
I am on the line. Can everybody hear me?
Yeah, we can hear you perfectly. So, do you have any? Go ahead. Go ahead.
No, I'm glad I dialed into the wrong number for starters. I'm glad I'm connected to everyone. Thanks for having us here to chat. We have 4 pieces of legislation that are going to be moving forward this year, none of which, thankfully, are as much of a list as we had last year with Medicaid expansion and the creation of adult dental, but important nonetheless. We have one piece that's around aligning state Medicaid eligibility categories and statute. This is something that we had discussed with stakeholders last year, but did not move forward as a bill. Essentially what it is that we have a lot of obsolete eligibility categories listed in our statutes that are no longer relevant. And under the Affordable Care Act, there's 4 categories that someone will fit into, either child, pregnant woman, parents and caretakers, and adults. And so everyone will fit into one of those 4 categories. And so the kind of mess that we have outlined in the statutes is really confusing. It's a transparency issue. It's also a liability issue for the department to leave these obsolete pieces in there when they're no longer relevant and they're no longer true to law as to eligibility categories. So what we were looking to do is just consolidate those categories and put in the new federal, the 4 federal categories. This is purely a statutory cleanup. It will not affect anyone's services. It won't affect anyone's eligibility. So it won't actually have any impact on client care, client services, or how eligibility is determined. Purely a statutory cleanup, again, for transparency issues as well as liability concerns from the department. That's the first piece that we have. And then we have something around the nursing facilities and how we pay nursing facilities per diem. And essentially those per diems can be appealed throughout the process, and then those appeals we've seen a general uptick in the last few years, and we've had to come back to the General Assembly and ask for additional general fund dollars through the supplemental process. And so one of the things that we've worked out with the nursing facilities in the off session is to come up with a process for those payments to come out of their provider fee. I don't know that this will have an impact on counties, and if it does, I'd love to hear about it, but we've been just predominantly working with the nursing facility community on this issue and reached a consensus on it. We had a transfer authority, an extension of our transfer authority that Sarah had mentioned between the 2 departments, purely that the repeal date needs to be extended. And similar to that, the 4th piece of legislation is actually HICPOF has the ability to overextend general fund dollars to pay for medical services. in order, we can't turn someone away from medical services saying, sorry, we've reached our general fund appropriation limit. So we do have the ability to overextend to pay for care, and that also repeals this year. And so what we have to do is come back every couple of years, I think every 5 years, and ask for an extension from the General Assembly on our ability to overextend. That is the federal law requirement, so it shouldn't be an issue in terms of us being able to move that forward. And that's it. Those are our 4 pieces.
Great. Do we have any questions for Mary Catherine? I know that Mike Wagner is also here. He is the county liaison from the Colorado Department of Healthcare Policy and Financing. Mike, did you have anything else to add? Okay, great. Kathleen, are you on the phone? Kathleen Matthews and Eliza with the Colorado Department of Public Health and Environment. Are you on the line?
Eliza's here.
Wonderful, Eliza. You are up next if you're ready to go.
Great, and thanks again for inviting me. I think this is a great opportunity to share everything that we think is coming this upcoming session. Because of the Department of Public Health and Environment, we have a number of bills that may not impact you all, but I'm just going to run through them because some of them have local components. I won't spend a ton of time on the environmental side. Folks have questions, please come chat with me, or we can answer them over the call here. So the first one that I want to talk about is medical marijuana. We were audited for our registry program, and our piece of the world is just the registry, so we issued a red card. They found a number of findings, and one of the findings was to spend down the cash fund is above our limit. So we have a couple of proposals, including $7 million to be spent towards research of the efficacy of medical marijuana for a variety of conditions. So we're hearing anecdotal evidence that marijuana is working for PTSD or children with seizures, but there's not a lot of medical literature out there. So we're hoping to add to the body of science by creating a grants program. We know that actually a lot of families are moving from out of state and actually out of the country into the Colorado Springs area because there's a medical marijuana producer who makes a tincture that I guess has been working for children with seizures. So more to come on that. Along with that, we will be talking about who has access to the data of the registry. Right now, we are sharing plant and ounce count with local law enforcement, but there's some question as to whether or not we have the legal standing to do that. So the audit recommended that we reach out to the Attorney General's office to get some legal guidance. We have done so, but have not heard back, and our 6-month check-in with the audit committee is going to be in January. So hopefully we'll have a better idea of what our legal standing is prior to that meeting. The next one also has to do with local law enforcement. 2 years ago, we had to replace the evidential breath alcohol testers, the toxicizers that someone would blow into if they're pulled over for a DUI. CDPHG purchases and maintains all of these toxicizers statewide for all law enforcement. We had to scramble at the last minute to find enough funding to replace them statewide, and you need to replace them statewide so that every jurisdiction is using the same instrumentation so there's not holes in the prosecution or defense. So we would like to find a sustainable funding source to be able to replace these again in 8 to 10 years when their shelf life has run out. So our funding source is an increase of the convicted DUI penalty of $10. That'll give us roughly $200,000 a year for a total of $2 million in 10 years to replace these statewide so local law enforcement won't be out any dollars. Waste tires. I know that may not be an issue for this group, but I know a lot of county commissioners care about this issue, and in particular, this particular piece of it. So we have a program called the Waste Tire Cleanup Fund, and it's through the governor's budget. He put about $500,000 or $600,000 into this fund. Because the fund is based on a reimbursement with local government, so the local government puts up the money and then we reimburse them. We haven't actually had a lot of applications, and we've heard from local governments that they just don't have the money to begin with. So we're going to need statutory fixes to make sure we spend this money in this area instead of having it roll over to a different fund. So we've done some statutory changes to say that CDPHG can just pay a contractor directly, so there isn't this reimbursement, and then hopefully we can get the money out the door sooner and help to clean up any illegal waste tire dumps. We are working with the Water Resources Review Committee on another bill, and that has to do with small community drinking water and wastewater grants program. This bill was something that we worked on with CML in 2009, and it's funded through the severance tax. After severance is a certain point, a portion of that overflow goes into this fund. We actually haven't had any money in there yet, but we're expecting to get some in the next year or two. Small community is defined as 5,000 or less, so if you have those in your county, if you're impacted by the floods or just want to do improvements for water, this money would be eligible for you. And this just clarifies that we can use it both for drinking water and wastewater. On the next one has to do with prescription drug take-back. We run a program at CDPHE called the Colorado Prescription Take-Back Program, and we partner with foundations and a variety of other folks who provide us with gift grants and donations to run the program. There are 11 drop boxes around the state, so mostly in the metro area, and they all actually happen to be King Super locations. King Supers is the only ones to stick their neck out. Safeway and Walgreens and other retailers have expressed interest about having these drop boxes at their pharmacies that have been worried about liability issues. So this bill is intended to remove some barriers to encourage folks to participate in this program to get prescription drugs that are either unused or expired out of the home. And we don't want you flushing them down the toilet because that's bad for water quality, and we don't want you throwing them in the landfill because that's not good either. So this would be a way to dispose of your unused medications. And we want to say that if you're a participant in the approved Colorado Prescription Drug Take-Back Program and you're playing by the rules and doing the right thing, that you don't have liability if something were to happen, like you get robbed or there's a natural disaster, hurricane, or tornado or flood. So we'll be working on that one as well. There's another one that is related to CWES. We do information sharing with research institutions and universities and all sorts of folks who are doing research. We have unique data sets as a public health authority and have unique authority to actually go out and see some of the data. So these would be things like the birth rate survey or how many minority women are smoking in 2008 versus 2012, or things like that.
Oh, Eliza, I'm so sorry. I think that somebody put us on hold.
That's right. I'll be quick. So we've been providing this data, and we've been charging the entities who requested it for staff time to pull the information or actually to go out and seek it. And we just found out from our AG that we've been interpreting the statute too broadly, and actually we don't have the authority to charge for this tax credit. So we'd like a bill to clarify that we can, so we can continue providing this service to the community. And then there's one more budget request that I think is worth mentioning. CDPHE and the Water Quality Control Commission promulgated rules in 2012 related to nutrients in water. And last year we ran a bill that was supposed to give out $15 million in grants for communities who needed to start planning for nutrients. The governor put forward $12 million in his budget this year for nutrients, but also for flood recovery. So if communities are struggling, we hope that they can use this money as their FEMA match so that they can get their drinking water or wastewater program back to the running. And that's all I have. I'm happy to answer questions. I don't know if all of that was relevant to this group, but better to overshare.
Well, we absolutely appreciate your time, Eliza. Is there anybody that has any questions for Eliza? Please feel free to type in your questions. Seeing none, we just want to say thank you so much to all of our sister agencies who took time to do this joint presentation today, as well as CCI. We hope that you found it beneficial, and we will be following up, sharing once again the information that we sent out prior to the webinar, including links to the SMART presentations from each of our departments, the document that Jenny referenced, as well as the documents that Clint referenced. So,
welcome to Verizon Web.
Thank you once again for participating.
Nope, thanks for joining us. So we're sorry about the technical difficulties at the beginning. Our computer was running incredibly slow for some unknown reason. So thanks for being patient with us as always. See you next month.